Now, a video clip of an unvaccinated doctor challenging the health secretary over government plans to make the COVID jab mandatory for all NHS staff very soon now has gone viral.
Dr. Steve James is a consultant anaesthetist at King's College Hospital in London, and he's been working in the ICU there since early 2020, the beginning of the pandemic. And on a visit by the health secretary, he told Sajid Javid the science isn't strong enough to support the policy of mandatory vaccination for NHS staff. Let's hear what he had to say.
You're not happy with that, tell me.
So I've had COVID at some point.
Yeah.
I've got antibodies.
Yeah.
I've been working on COVID ITU since the beginning. I have not had a vaccination. I do not want to have a vaccination. And for that, I would be dismissed if I don't have a vaccine. It's not, the science isn't strong enough.
Well, Dr. Steve James is joining us live now from his home. As Susanna said, that thing went viral. So many millions of people have seen it. And basically, Dr. Jones, that's made you the poster doc for the whole anti-vax movement. But that's not a kind of hat that you want to wear. And you've come on Good Morning Britain to try and put the record straight. So where exactly do you stand on vaccination?
Firstly, thank you very, very much for giving me the opportunity to be here. If I'm the voice of anything, I'm the voice of 100,000 NHS staff already lost their jobs, people whose voice hasn't been heard.
OK, but can you do what I think you're here to do, which is to explain why you're not anti-vax?
Well, I'm not anti-vax because I've seen a great benefit from vaccines. There's been a huge reduction in the number of seriously ill patients who've come into hospital, and vaccination has probably made, or it's almost certainly made, the largest contribution to that.
So why did you say that to Javid?
So the difference between me giving my own personal opinion about why I wouldn't have a vaccine and whether vaccines in general are good. So, you know, as a doctor, I'm not anti-surgery, but it doesn't mean that surgery is what I need to have. So for a population, it'd be good to offer certain treatments. Doesn't mean that everybody needs to have those treatments.
So why haven't you been vaccinated?
Personally, I'm a fit and well man. I'm not elderly. I was exposed to COVID on multiple occasions in hospital settings, and I wasn't getting sick. And I thought, well, the vaccines are out there now. They'll go to the elderly and the vulnerable. And I was surprised to see that there wasn't a point where instead of saying, OK, instead of offering it to everyone, we're now going to start offering it to people in a more nuanced way.
But being fit and young and well is no defence against COVID. Young, fit people have died from it.
I haven't seen anyone who's young and fit and well and has died of COVID. Now, there are always going to be exceptions, but young, fit and healthy people also die of other things. So I thought I would just sit and wait and see, sit and wait. Yesterday, the director of the CDC announced that more than 75% of deaths in the US have been in people with 4 or more comorbidities. So out of that 25%, a lot of them have got 3, have got 2, have got 1. I still haven't seen anybody who's died in my hospital, not to say it hasn't happened, but who hasn't got any comorbidities or any issues.
Just to be clear, you are speaking entirely in a personal capacity and not as a representative for the hospital. You won't get vaccinated, and you've explained why you believe you don't need to. Just want to establish, you say you've been exposed to COVID. Have you actually had COVID?
I haven't had a symptomatic episode that I know to be COVID. So I had one fever in the last 2 years. It came on in an evening. When I did the next tests, I was negative. So I don't know if I had it symptomatically, but I've got antibodies that show that I've had it.
How do you know that? Do you get an antibody test offered to you in your work?
No, it's not offered to me in work, but I've had one done.
You've had what, sorry? You've had what?
He's had an antibody test done, and that would be privately, presumably, would it?
Well, I asked at the hospital if it's possible to get one done, and I got one done then.
And just to clarify then, if anybody is carrying antibodies to COVID, are you saying that automatically means that they must have been infected with it at some point?
Yeah, if you're carrying antibodies to a virus, you've developed an immune system's memory because you develop that memory because you've been exposed to it before.
Okay, so it's the kind of Novak Djokovic defence against vaccination, isn't it?
Yeah.
But, Dr. James, you are not going to get vaccinated. You've said that. You've had that argument with the Health Secretary. Of course, that comes with a penalty within the NHS, because from April, if you aren't vaccinated, you'll lose your job. Are you prepared to simply lose your work for the sake of taking a vaccination, which we know, and you have explained, is enormously beneficial?
So the benefit is for people who are likely to have a serious consequence. So the benefit isn't there for me. For me, it's a point of principle that 100,000 members of my profession who have made careful and valued assessments for themselves in the majority of cases, that they are not being forced to have a vaccine, to have a medical intervention, which up until current epidemic was outlawed in public health acts, that even in health crises, these things weren't going to be allowed. And now the government's changed its mind and said that we think it's there. But the government reports from the House of Commons, from select committees, from the House of Lords, they say the scientific evidence isn't strong enough.
Well, are you arguing this purely from, if you like, a civil rights point of view, or are you also suggesting, as I think you might have done in that exchange with Javid, that you don't trust the vaccine all the way? You don't think it's been researched fully enough? Am I right to summarise it that way?
Sorry, I lost a little bit. You were saying, am I arguing it purely from a civil rights point of view?
Well, OK, I'll repeat the question. Are you arguing this, as I say, from a human rights, civil rights point of view, personal freedom, or do you also have your suspicions that the vaccine isn't 100% trustworthy?
So my concern is the civil liberties side. I think the vaccines proved to be very safe, however, very safe over the period of time we've looked at it. So I'd like to look at it for a longer period of time. But as my mum said to me last night, she said, if King's is going to lose 1,400 members of staff, then how's the NHS going to survive? And you've got to look at the practicality.
Dr. James, what I don't understand is you're prepared to lose your job and put your department under pressure as a result of you losing a job, because I don't know, how easy it can be to get an anaesthetist with your sort of training and qualifications in there, despite the fact you believe the vaccine is safe and effective. I'm not sure I understand it. Anyway, let's talk to Dr. Hillary about it, because Dr. James says he doesn't want to be a poster boy for the anti-vax movement. I can't see how he avoids that, frankly.
Yeah, look, I'm not going to get anything like equal time to refute what Stephen James has said. The basic point that I'd like to make is the vast majority of doctors and scientists think the science is plenty strong enough to support vaccination and mandatory vaccination for NHS staff in contact with patients. By his own admission, he's got antibodies. So at some point, he's been in contact with coronavirus and has been capable of transmitting coronavirus to the sickest patients in society in intensive and critical care. That's the first point. Having not been vaccinated, he is likely to have a higher viral load when he's been infectious and to carry that virus for longer. And all the science shows that transmission in an unvaccinated person is likely to carry on for longer than it would in a vaccinated person. So he talks about the risk to himself. There is an ethical duty for doctors under the GMC regulations in communicable diseases to immunise yourself to protect the risk to your patients. And clearly that isn't happening here. And
you have the extra consequence that because of his refusal, and we understand, I think, 1 in 10 NHS staff currently not vaccinated. Yep. Losing that number of staff and some of them massive. Absolutely. At a time of huge pressure on the NHS. I understand that. And a lot of doctors and scientists are infuriated that because a lot of them were hesitant facing this deadline that's fast approaching, that this will have done a lot of damage, that this will have dissuaded them from actually overcoming that hesitancy and coming forward and being vaccinated. Well,
we have to go back then for the right of reply to that telling off to Dr. James. That was in effect a telling off from one of your fellow professional doctors. He says that your behaviour is, if you like, selfish. What you're doing is for your own interests and good and to support your political views in terms of human rights and civil rights, but you're putting patients at risk. You've actually put patients at risk.
10% of the NHS staff are essentially in the same position as me. I'm not a fringe person. I'm having an expression of my voice, a voice which hasn't been heard. I've got thousands and thousands of positive comments from people. Hundreds of doctors and nurses have contacted me saying, thank you, let's open this debate up. The debate has not been held. Many groups of doctors, of other politicians have said the science isn't strong enough. And if we don't have a debate, if it's a single story, if it's a single narrative, that's not science. Science is questioning it.
Absolutely, and your voice has been heard. It's been heard here, and that's our job. Thank you very much. Thank you very much indeed for coming on. Thank you, Hilary, for putting the other point of view.